Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Thank you for joining us this morning. My name is Farhan Rais, and on behalf of BJRA, I welcome you to our online talk about good dental hygiene and health. So we are a vibrant community, and we love to stay connected with all our residents to keep them well informed of good habits and good practices at home. I have great pleasure in introducing our guests for this morning. Good morning, Dr. Muhammad from UITM and Puan Noor Aisha, who will be joining in shortly. So let me give a brief introduction to Dr. Muhammad. About Dr. Muhammad. Dr. Muhammad graduated from UITM Malaysia in 2012. He joined UITM as a dental officer since 2013 in the primary care unit, elevating to the head of the primary care unit since 2019. Dr. Muhammad obtained his membership of the Faculty of Dental Surgery (MFDS) of the Royal College of Surgeons of Edinburgh in 2018. He is currently doing his master's studies in UITM. Now about our other special guest, Puan Noor Aisha binti Kamaruzzaman. Puan Noor Aisha graduated with a diploma from the College of Dentistry in Georgetown, Penang. She has served at the Faculty of Dentistry UITM for 13 years. Ladies and gentlemen, we now invite our special guests to deliver their talks. Okay, on to you, Dr. Muhammad.
Assalamualaikum warahmatullahi wabarakatuh and selamat sejahtera. Very good morning, everyone. Thank you, Encik Farhan, for the nice introduction. And thank you, BGRA, for inviting me to give the talk for oral healthcare for today. Encik Farhan, can you change for the other slides, oral healthcare, the one with the blue circles?
Which one are you talking about?
The other one.
To go to the next slide.
No, I mean the other slides. Do you still have it?
I don't think. Oh wait, it's connected. Yes, it's here.
Yes. All right. Okay. That's one. Okay. So today I'm going to give it's a very simple talk. We keep it casual, which is about oral health care. So what the tips and how we take care of about mouth and what structure that are there, and especially Ramadan is coming for our brothers Muslims and sisters as well. So we need to improve our oral health care, and especially in Ramadan there will be a bit of different timing of our waking up quite early for sahur and buka puasa late. So there will be a bit of tips for Ramadan as well. So we're going to proceed with the outline. So we're going to talk about a bit of anatomy, mouth anatomy, tooth anatomies. What are the teeth types that we have inside our mouth? What is plaque and is it thick? What is plaque and calculus, caries, gum diseases, and some tips. So anatomy. What is anatomy? Meaning that what are the structure, how the structure look like. So this anatomy is a description of the structure that within the human body. So I'm not going to touch a lot of anatomy. It's just about what we have in our mouth. So mouth anatomy. So looking at the picture there, we can see that this is how the mouth should look like. And the top part there is we can see the upper lips there, the lower lips there. Then in between it, that is the mouth structures. We can see there is gum if we're looking from top to bottom. So the gum of the upper teeth. Then we have the upper teeth. Then we have the hard palate. Palate dalam bahasa Melayu, we call it langgit. And the palate is divided two parts. It is hard palate, soft palate, and attached to the soft palate is the uvula, is the dingling part there at the end of the mouth, which is function in tonations and also for very important aspect of food swallowing. Then at the back there, at the throat, there are the tonsils. Then from there, we can see the tongue, then the floor of the mouth, then the lower teeth, the gum, and the lower lips. So basically, these are the structures. All these structures are important for multiple aspects, which is include speaking, smile, which is in give us of confidence of how we're acting with others. As one of the important thing in aesthetic is smile and interaction, and also chewing food. So without the teeth, without all these structure, will be difficult to chew the food that we are eating. Okay, we go to the next slide. Now we have tooth anatomy. So basically we want to talk exactly about tooth by itself. So the tooth is divided into two parts. The top part, we call it the crown, which is the part is visible inside our mouth. But there is one more part, we call it the root. That is part is covered by the gum, the bone, and also part between the gum and the bone, which is we called it periodontal ligaments. These are basically fibers that act as a shock absorber. So every time we bite, the root of the tooth doesn't come direct contact with the bone. So these fibers will absorb the shock. So now we go to the crown. So the crown is composed of initially three structures. The outermost layer, which is we called enamel, it is the hardest structure in the human body. It's function as a cover for the tooth, for the crown of the tooth, and it is very hard so it's to function and also to protect the tooth. So it is because of it's so hard, it's very resistant for forces and also very resistant to acids. But by time, if the acid is there for a long time, then it will cause what we call lubang or caries. The structure below it is dentine. The dentine is the second hardest structure in the body. The difference between enamel and dentine is the enamel is smooth, hard structure, while the dentine have some porosity or tubules inside it, which function to feel hot and cold. Therefore, it has a protective effect. So if we drink something very cold or very hot, then we can feel it. Then inner to it, that is what we call the pulp. So basically the pulp is what is the soft tissue, blood vessels, the nerve is there. So basically that give the innervation and vitality for the tooth. The root is similarly composed to the crown. There is the dentine. The pulp there, we call it pulp canals because it's canals that connected from the root, from the bone, where the innervation come to the pulp. And then the only difference is it is not covered by enamel on the top, it's covered by cementum, which is as hard as dentine, slightly less harder than dentine, and its function to connect the bone to the roots. So it's a bit of porous because of the fibers from the bone of the periodontal ligaments to the roots are attached. So it is involved in the mechanical absorption of forces while we are eating or speaking. So basically this is a simple explanation of the tooth anatomy. So now we talk about teeth types. So basically we had a set of teeth. The initial set of teeth we call primary teeth or gigi susu, milk teeth. So basically there are 20 of them. And the first tooth to erupt is in the mouth is the lower central incisors around the age of 6 to 10 months. And then follow out by the upper central incisors, then the upper lateral incisors, then the lower lateral incisors. Then the molars will erupt, the first molar, then the canines, then the last molars. Okay, it's very important to keep track of the tooth eruption sequence and the eruption timing. Sometimes some children, they have what we call delay eruption, or for some reasons the gum is too thick, so it's prevent teeth from erupt. So usually by the age of 6 to 7, we advise the parents to bring the child to a dentist or for examination. One thing is to teach the parents how to take care when the teeth erupt, and also to check the eruption of the teeth and how nice they come inside the mouth and what is the condition of the teeth. Sometimes there are some issues with the eruption, so we need to keep track of it. So that's one depending on the dentist, your family dentist that you always visit. So you need to keep the advice that is given by the dentist. All right. Now we have what we call the permanent teeth or GIGI. So basically there are 32 of them. But usually the last 4, which is the wisdom teeth or gigi bungsu, we don't count it, so 28. So basically the first tooth to come out inside the mouth is also the lower central incisor, which is around of age 6 to 7. And the sequence of eruption will from for the first lower molar, lower permanent teeth, to the last permanent teeth, which is the second molar, is around the age between 6 to 12 to 13. The only exception is wisdom teeth, which will usually come out after the age of 18, 17 to 18. But sometimes even we have some people who develop the wisdom tooth and coming inside their mouth around the age of 30 or 30 plus. So usually if the wisdom tooth doesn't come out, there's some cases, some condition that wisdom tooth, there's no air space within the jaw or rahang for it to come out inside the mouth. So that's normal. As long as it doesn't give any problems, we don't need to do anything about it. But if it gives swelling or pain, then we need to consult with the healthcare provider in terms of dentist. Okay, all right. So now we talk about plaque and what is plaque and what is effect. So what is plaque? So basically plaque, we see the picture on the right side. That is what's plaque. We see the probe that's carrying the soft deposit, the white deposit from the teeth. That is what we call plaque. So basically after we brush, after around within some research around 30 minutes to 1 hour, a soft deposit layer form on the teeth. It is very thin. It is almost kind of seen by naked eye. So it is a mixture of saliva, proteins from the saliva and the gum fluid, and also the bacteria inside the mouth. And the bacteria, some of them they are normal bacteria, good bacteria, and some of them bad bacteria. But with a proper oral hygiene, it is usually being removed. But if oral hygiene was not practiced properly and with the specific type of diet, the plaque will increase in thickness. As you can see in the picture, there's quite considered quite a lot of plaque, and it is considered as a very poor oral hygiene because there is a thick layer of plaque on the teeth. So when this thing happens, it promotes bad bacteria to grow on the teeth. Therefore, when there's bad bacteria on the teeth inside the plaque, it promotes for oral diseases, whether it is caries, gum diseases, bad breath, or any other things. So this plaque is actually a combination of saliva, protein, as I said, gum fluid, and bacteria. And depending on the diet and the oral hygiene, the bacteria composition or the bacteria type will be different from good bacteria to bad bacteria. If this plaque stayed in the teeth for more than 3 days, some research says the 3 to 7 days, the plaque will absorb minerals from diet, from the saliva, and from the gum fluid. And then we have what we call calculus, or we call in Bahasa Melayu GIGI on the left side. So you can see on the left side pictures, GIGI basically is plaque that has been hardened up. Meaning hardened up is become very hard. It cannot be removed by brushing, similar to plaque. Plaque, you can brush it off. Calculus, you cannot brush it off, and it needs to be removed professionally by a dentist or dental surgeon. All right. So basically, what's the difference or the problem of calculus? It's a hard structure that is deposited on the teeth, and it is time by time. If the persons who are having calculus and poor oral hygiene and neglecting to do anything about it, it will start building up, and the more it builds, the more thick it become, and it start giving gum problems, and also it's harbor bacteria because the surface is not smooth, as it's structure, it's very hard, it's very rough, so a lot of bacteria there, and giving mostly gum problems, and also sometimes give caries as well. Other than that, because of the bacteria and a lot of plaque on it, it can cause bad odor, and sometimes with the poor oral hygiene, it can cause another forms of fungal infection, but it's not commonly caused. But sometimes it's happening because of the poor oral hygiene. So basically, these are the differences between plaque and calculus. Plaque, basically, it is a soft deposit. Calculus is a hard deposit. Plaque can remove by brushing. Calculus cannot be removed by brushing. You have to go to a dentist to do what we call scaling and polishing, and or bahasa Melayu we call cuci gigi. And then both of these plaque is preventable, while calculus, once it's happened, then we need to go for treatment. And both of them have a devastating consequence for teeth and oral health. So, what is caries? Caries bahasa Melayu we call gigi berlubang or lubang dalam gigi. So basically, once there's a caries there, it's not necessarily as a big cavity. It can start as very small cavity, and by time it increased in size until it's become big. So, if a regular checkup has been done, and sometimes you look into your child mouth, or you ask your partner to look inside your mouth, and you see there's a bit of dark staining in your teeth, around your teeth, then you can go consultation for a dentist to determine whether this is only a staining or it is a proper cavity or it's a real cavity there. So if it is detected early, most of the time people doesn't feel anything, and a simple treatment can be done. But if it is neglected over time, the caries will become bigger and bigger, then the treatment will become more complicated, and sometimes there is no treatment except for extraction because there's not enough tooth structure to put a filling there. So basically, the caries is a slow process of developing cavity inside the tooth, and this development of cavity is depending on multiple factors. And what's the problem of caries? Number one, there's a cavity inside the mouth. Number two, it can cause toothache, and depending on how big and how deep the caries is and whether it is involving the nerve. And sometimes the toothache, it can be really painful that prevent you from sleep or focusing on doing your daily activities or work. And sometimes it can give abscess, and these abscesses, it can be small within the gum only, or it can be big that involve the face and go to important structure like below the face, below the jaw, or around the face, which we considered as serious and life-threatening infections that we need to do treatment for it. So depending on the source of the tooth that giving the abscess or giving the nana, then which extension is goes for, it can be a life-threatening condition. So therefore, detecting it early is very important, and the better at it, preventing from having caries is the most important thing in terms of caries. Now we're going to talk about caries. So basically, we're going to talk about how caries are formed, or what are the things that promote for forming of caries. So basically, there are four important factors. Four important factors that will lead to caries, and absence of one of these factors or two of these factors, it will prevent caries. So basically, we go from the first one, which is diet. That basically the food that we are eating. So there are some certain diets that promote caries formation. So basically, what's and how the diet that promote caries formation. So basically, the bacteria that living inside the plaque, if it is there for a long time, so it is more bad bacteria are there. And there are certain kind of food that promote bad bacteria to grow. And usually this kind of food, they are carbohydrate and sugary foods. So it's like candies, white sugar, all these kind of things will promote bad bacteria to grow. Why it promote bad bacteria to grow? Because it's easily metabolized by these kind of bacteria. And once it is metabolized, they can grow more, and they will make a happy family with a lot of income of food there. So once the sugar is there, the bacteria will utilize it, it will grow, and usually sugary diet and carbohydrate diets, it usually promote bacteria to produce a very low pH acid that attack the teeth. So therefore, it will form caries, or what we call lubang. So usually like candies, sugary drinks, sodas, all these kind of things that will promote that bacteria. There are certain kind of food that include calcium, like milk or dairy products, that is considered non-harmful for the teeth, and it is will improve on calcium exchange between from the food to the teeth. There are certain aspects of food or diet that we need to touch on as well, what we call hidden sugars. Sometimes like sugary drinks, we know that there is sugar in it. Chocolate or candies, we know there are sugar in it, but there are what we call hidden sugars. So these are also have a very devastating effect, and usually people doesn't know about it. So on an example, ketchup sauce, chili sauce, it have sugar in it, even though we don't know about it. Sometimes masa like hua or curry or gravies, sometimes some kind of this masa people will put sugar in it. Most of the product in the shelf, like canned food, have sugar in it. So these kind of things we need to be aware, and we need to read the ingredients. Why it is important? If we know there's sugar about it, then we know how to tackle the problems, is either by avoid it, but sometimes, I mean, we are human human beings, we are people, we like to enjoy our food, we like to eat rendang, we like to have a bottle of soda or bottle of cola from time to time. So there are some tips about it that I'm going to touch later on, what we do if we take sugar, and how we, even though that we take sugar, how we improve on our oral hygiene in order to minimize the risk of dental caries and other conditions. So that is for that. So now we go for the host factor. So the host factor is about our individuality, our our human beings, we are from individual to individual, we are different. So if you look at the picture of the teeth here, the first picture on the left, we can see the tooth. There is dark staining in the middle. This is what we call pit and fissures. And from individual to individual and from tooth to tooth, there can be different. And in certain cases, like this case, we call it deep pits and fissure, where food is easily stuck there, sugar is easily stuck there, and bacteria can grow easily because it's a deep pit and fissure and it's difficult to clean. Therefore, if individual have a deep pit and fissures, once they consult with the dentist, they need to do what we do a fissure sealant. So it's a small filling material. It can be done very short. It's a very safe procedure. It is very short, non-harmful, non-painful. It takes around a few minutes. So they can seal the pit and fissures. And this is usually by advice of a dentist. There's certain criteria of the individual is at risk of caries and there's a deep pit and fissures, then we're advised to do it. So on the picture on the left side, you can see of the tooth there, there's the white material. This is what we call fissure sealant. So it's one of the factors. Another host factor is the saliva. So the saliva usually, in all the individual, the saliva is normal at the normal consistency, at the normal thickness. And the saliva is important because it has two functions. One thing is heavy cleansing. It's just like a running water there that wash the food and the plaque there to a certain degree. The other thing, it has antimicrobial antigens inside it. So these agents in the saliva will try to control the bacteria to a certain degree. But in certain conditions or certain diseases that affect the salivary gland inside our mouth, it will have a reduced salivary flow rate or reduced saliva inside the mouth. So when there is reduced saliva inside the mouth, the cleansing effect and antibacterial effect of saliva would be reduced. Therefore, the individual with salivary gland disease at a higher risk of caries or gum diseases. There are other conditions that reduce saliva producing inside the mouth, such as people on hypertension. They can be on medication, diuretics. So this one is also sometimes promote to reduce salivary flow inside the mouth. So they are at the same risk. So that's one, depending on the medication that you are taking or the condition that you have, then you need to consult with your dentist to determine is that you are at risk of caries. If you are at risk, what the things you need to do to minimize the risk of dental caries. The other factor is microorganism. So basically, everyone having bacteria inside the mouth, and the mouth is considered is the most place inside the human body with the highest amount of microorganism in terms of numbers and in terms of types. But are they all harmful? Not necessarily. And how we can control it? Basically by proper oral hygiene. The proper oral hygiene will reduce the amount of bad bacteria in terms of numbers, so it doesn't cause any harm to the mouth. And all these factors require time. Caries doesn't happen overnight. So basically, caries will take long time to happen for us to form. It will take few days to few weeks to few months. There's no like someone's. I usually see this kind of patient. Oh, doctor, there is a big cavity inside the mouth. Previously, it was not there. Last week, it was not there. Actually, that caries is being there, but usually it is hidden caries, and to the point when tooth structure cannot support the tooth from the forces of mastication or forces of chewing the food, so the whole tooth collapse. Then it seems to be a big cavity. So it's a long process. It's happened over a few weeks to few months. So therefore, when it's happened over a few weeks or few months, we have the control over it in terms of preventing it. Therefore, proper oral hygiene along with proper visit to a dentist at regular times is very important. Another condition that is most people are not aware of, what we call gum disease or gum diseases. So basically, the picture at the most left there, there's a healthy gum with a tooth. You can see the tooth there with a nice pinky gum and the bone there. Once plaque and calculus start to deposit, initially the red part of the gum on top start to become red. And once it is red, it start giving problem. And we start while we're brushing, it bleeds. So if for any certain reasons the individual neglected the plaque and calculus will become more and more, and we will form in the third picture we see periodontitis. There's what we call pocket, so it is placed between the tooth and between the bone and the gum. So the teeth become a bit mobile. It is slightly shaking inside the mouth, and if it is stay there longer and it's been neglecting longer, we have the picture at the rightmost, which is what we call advanced periodontitis with a severe gum problem basically. So the bone is less, the teeth is very mobile, and in certain cases and certain conditions, even we see cases where the tooth come out from the mouth while person is chewing or doing normal activities. It's very rare to the tooth to come out from inside the mouth while eating, but it happens, and that is due to basically negligence of oral hygiene and proper follow-ups. There are certain conditions actually complicate these kind of things. People who are diabetic, they are prone to gum diseases faster compared to other people because of their condition. So these all carries gum diseases. They are all preventable by certain tips and how to take care of your mouth. So we're almost at the end of my slide today. Then later on, Panasha will take. So how we want to take of oral hygiene. So initially, we need to understand the importance of oral hygiene. If we understand the importance, then we're going to appreciate the information that we are getting. Then we're going to do it autopilot mode. I like it to call autopilot mode. Once we appreciate things, we start doing it without even thinking about it. So we need to make it as habit for the oral hygiene. And I'm not sure most of the people who are listening to me today, whether they are teenagers or they are parents. So basically, for parents, especially with their children around the age of toddlers or they are in primary school, you are in charge of your children oral hygiene. They are at the age where they cannot comprehend this amount of information. They cannot appreciate the importance of teeth and the mouth. So therefore, you are in charge and you need to take care of it. All right. So I always got this question, Doktor, tak apa gigi susu tu, tak apa lubang pun kita boleh cabut, nanti gigi kekal akan keluar. Actually, that is a wrong concept. We need to teach children from young how to take care of their mouth and develop it as habit. So the teeth are always clean, the teeth are sound, healthy. So when the gigi kekal tumbuh, also is healthy. And actually, there are later on Panasha will describe how it is important the primary teeth inside the mouth. Right. So brushing is around 2 to 3 times per day. Before sleep is a must. Why before sleep is a must? Because during sleep, when the body activity overall will reduce, which is called the neural effect. So the saliva flow is less, the tongue doesn't move, the cheek doesn't move. The tongue and cheeks, by moving around inside our mouth while we're speaking or chewing, actually is rubbing against our teeth, so it's cleaning up our teeth. So during sleep, the tongue and cheeks, they are not moving. The saliva is not producing like a normal throughout the day. They're at a minimum rate at sleep. So this is why the protective effect from saliva, cheek, and tongue are reduced. Therefore, before sleep is a must. Otherwise, if you don't brush before sleep and you take something sugary, the bacteria will be happily making families around the teeth and the tongue. Okay. What are the timings for brushing? Usually they are after meals. So after breakfast or after lunch is very important to brush. I know as we are Asian, we wake up in the morning, we brush. That is more of like to clean up our mouth and to give a good odor for our mouth, but actually in terms of protection of teeth is not so much effective. But you can brush early morning while we are mandi and everything, but then you need to brush after meals. So usually I like to do this, and usually I advise my family to do. Every time we take something sugary, something sweet, then we need to brush. So basically, let's say you drink kind of cola, then brush your teeth. Let's say you're outside, you are a place where you don't have access to sink, brush, and everything. What you can do, after you drink kind of cola, you take a sip of water and move it around your mouth. So basically, you are trying to wash as much sugar as possible from your teeth and from your cheek and tongue, and swallow it. You don't need to take a lot of water, just a bit of sip of water and moving around your mouth. It's similar to people who are in offices who are working. They take coffee, 3-in-1 instant coffee. After taking coffee, also take a sip. After you finish the coffee, take a sip of water, because coffee, one thing is have sugar, the other thing is called staining for the teeth. So it's better to take one sip of water after coffee. So that's one if you don't have access for brush and sink on the facilities to do brushing. Otherwise, it's usually advisable to do brushing after a sugary snack or meal. And one more thing is, for brushing, is not preferably you don't directly brush after food. You wait for half an hour first. The reason behind it, our taste bud is already stimulated by food, and then when you brush, you will feel the taste of the toothpaste quite there, and it is usually most of the toothpaste are not pleasant taste. And the other thing, we also want to allow the mechanism of the mouth in terms of saliva and tongue to clean up as much as possible before brushing. One more thing is floss, at least once per day. Before sleep is a must. If you want to do more than one time, then that's good. Later on, for brushing technique and flossing technique, one Aisha will talk about it. My advice for regular checkup every 8 to 12 months per year if you don't have any problem. And Tim's, I got this question a lot. Scaling is required every year. Scaling or GIGI is not required if you do very good oral hygiene. If you do very good oral hygiene, there's no plaque, there's no calculus, then you don't need to do scaling, all right? But basically, it depends on your dentist's opinion. They're going to check inside your mouth, they're going to use mirror, they're going to magnify, and they're going to see if there is any hidden calculus or plaque, they're going to clean up for you. So there are certain instructions for what kind of brushing technique, what kind of flossing technique, which are tailored per individual themselves. There are certain conditions that require certain techniques. Therefore, it's very important to follow up with the dentist every 8 to 12 months if you don't have any problem. So they're going to give you advice. If you have a problem, then they will detect the problem quite early, then they're going to advise you. With this, I end up my slides for today. And thank you so much. Thank you so much. Terima kasih. And if you have any question, please raise up these questions, and later on after Puan Aisha present, we're going to answer all your questions. If anything is not clear, please give a comment or send a message so we can answer your questions and we can clarify your concerns. Thank you. Okay, now, Puan Aisha, silakan.
Assalamualaikum dan selamat pagi kepada semua warga residensi Bukit Jelutong. Alhamdulillah, syukur kerana beri saya peluang untuk saya menyampaikan sedikit ceramah yang pendek berkenaan penjagaan kesihatan pergigian. Iaitu sikit sebanyak di mana ceramah ini kita boleh meningkatkan ilmu pengetahuan di semua golongan lah, daripada kanak-kanak sehingga golongan tua lah untuk kita praktikkan dalam kehidupan seharian kita. Okey, kesihatan pergigian kita perlu mula daripada awal usia, daripada start 6 bulan. Apabila anak-anak dah mula tumbuh gigi, kita dah start lah perlu menjaga kesihatan pergigian lah. Okey, perhatian awal kepada kesihatan pergigian dapat memberi manfaat sepanjang hayat, dan masalah kerosakan gigi peringkat awal masih tinggi di kalangan kita. So jadinya hari ini kita ambil sedikit ilmu lah berkenaan pencegahan dalam penjagaan kesihatan pergigian. Okey, kita terdapat dua jenis gigi, iaitu gigi susu dan gigi kekal. Gigi susu ni start daripada umur 6 bulan kita dah bermulanya tumbuh gigi susu, iaitu 20 batang kesemuanya lah, 10 batang rahang atas dan 10 batang rahang bawah. Dan manakala gigi kekal terdapat 32 batang, iaitu 16 batang rahang atas, 16 batang rahang bawah. Ada setengah orang kira tengok macam 28 gigi, 28 batang saja dalam satu mulut. Ya, memang ada yang 28 batang tunggu sampai 30 tak keluar-keluar juga kan. Okey, 32 batang ni yang 4 batang tu ada gigi bonsu. Kat mana setengah orang gigi bonsu dia tak keluar, tak ada ruang untuk keluar, so tertanam dekat bahagian rahang lah. Okey, rahang gigi. Okey, kepentingan gigi susu. Gigi susu ni penting untuk jadi panduan kepada pertumbuhan gigi kekal. Maksudnya kalau boleh gigi susu tu biar dia berada di dalam mulut mengikut umur, mengikut tahun dia. Maksudnya tak kalau elakkan daripada gigi susu cabut awal lah. Sebabnya ianya akan mengganggu pertumbuhan gigi kekal, kerana gigi susu ni dia akan membantu untuk menjadi panduan untuk gigi kekal akan irap lah, akan tumbuh ke gusi. Okey. Kepentingan utama gigi. Okey, kepentingan utama gigi mesti senyum kan. Tiap-tiap hari orang akan senyum. Kepentingan utama adalah senyum. Lagi confident lah bila senyum. Bila nampak gigi cantik, gigi penuh. So lagi tambah confident kita senyum. Dan makan. Okey, makan kita perlukan gigi. Makan tiap-tiap hari tu gigi main peranan lah untuk mengunyah, menggigit. Untuk orang kata mencari makanan, dia membantu proses salah satu proses pencernaan. Okey, dan bercakap. Okey, kita pun tiap-tiap hari kan bercakap, memerlukan gigi sebab ada certain perkataan dan huruf ni akan terganggu bila tak ada gigi. Contoh macam huruf S, H, F. Kalau tak ada gigi, mungkin perkataan tu kita tak dapat dikeluarkan dengan jelas dekat situ. Okey. Okey. Masalah gigi, okey, yang selalu terjadi adalah kerosakan gigi. Okey, tak kira umur sekarang gigi ni orang kata memang kebanyakannya memang selalu mengalami kerosakan gigi lah dalam golongan dewasa ataupun kanak-kanak lah. Ni contoh-contoh lah kerosakan gigi dalam gambar ni. Gigi depan, gigi belakang ni adik-adik sekolah-sekolah pun banyak terdedah dengan masalah gigi, kerosakan gigi. Okey, apa punca kerosakan gigi berlaku? Okey, kerosakan gigi berlaku ni selalunya adalah disebabkan oleh pengambilan makanan gula. Macam Dr. Muhammad sebelum ni ada bagi tahu pengambilan gula hidden sugar, kata kan, macam donat, air berkarbonat, air tin tu kandungan gula tinggi. Kek, bila makanan-makanan manis tu kalau macam kita makan, lepas tu kita tak praktikkan amalan untuk pencegahan seperti berus gigi apa semua, kuman dalam mulut kita masih ada, masih kuman akan duduk lama dekat permukaan gigi dan kumpul plaque. Bila dah lama berminggu-minggu, berbulan, so akan jadi ada asid dekat situ. Asid tu yang akan melemahkan permukaan gigi. Asid maksudnya kuman akan bergabung bila adanya gula, jadilah kuman terdapatnya kuman dan akan hasilkan asid. Okey, bila asid ni terjadi, adanya asid ni, ianya akan melemahkan struktur gigi. Dia akan sikit-sikit melemahkan struktur gigi dan menyebabkan gigi kita berlubang lah ataupun keris. Daripada gigi sihat terus akan jadi berlubang. Okey. Ini antara 5 langkah kendiri penjagaan kesihatan mulut yang kita perlu praktikkan lah. Yang pertama tu, gambar yang pertama tu adalah menggosok gigi. Kedua, floss. Ketiga, pemeriksaan gigi ataupun pemeriksaan mulut. Makanan seimbang dan berkumur. Okey. Okey, pemeriksaan mulut. Kita pemeriksaan mulut ni daripada kecil, kadang-kadang anak-anak kecil tak berani nak pergi ke klinik kan, takut apa. So ibu-ibu dekat rumah boleh pantau. Daripada rumah bukan saja dekat klinik saja kita boleh check, dekat rumah pun ibu-ibu boleh buat lift lah, maksudnya check counter gigi. Tunjuk kat dia gigi dia cantik tak, kira gigi. So dia kat situ dah ada minat untuk penjagaan gigi lah. Okey. Lepas tu pemeriksaan pergigian berkala ni paling kurang 1 kali setahun lah kita boleh pergi dekat dentist, tak kisahlah private ataupun KKM juga. Pemeriksaan berkala 1 tahun sekali. 1 tahun sekali at least kita boleh tahu kondisi ataupun keadaan dalam mulut kita macam mana. Jadinya walaupun masa kita tahu gigi kita tengok cantik, tak ada rosak pun, at least kita pergi untuk tengok kondisi keadaan gigi berlubang ke tak ke, apa yang perlu dibuat ke, ada masalah gusi ke. Dan makanan sihat dan seimbang ni baik untuk gigi lah. Contohnya kita digalakkan ambil makanan yang berserat ataupun susu. Susu tu baik untuk gigi kerana kandungan susu tu terdapat kalsium yang boleh menguatkan lagi struktur gigi dan makanan-makanan bersumberkan protein. Tu kita nak kurangkan, kita kena kurangkanlah makanan manis seperti macam air soda, kek, makanan tofi yang melekit-lekit tu yang mana makanan tofi tu selalu akan melekat dekat permukaan gigi. Sebab tu kita kena kurangkanlah yang tu. Okey, berus gigi dengan berkesan. Okey, berus gigi banyak teknik. Banyak teknik yang ada. Okey, salah satu cara yang saya nak tunjuk dekat semua adalah ni ni tunjuk. Okey, sekejap. Okey. Okey, ni ini model gigi saya tunjuk ni. Okey, ni model gigi, berus gigi. Okey. Okey, kita kena gosok gigi bukan saja di luar bukan sahaja di luar permukaan gigi, tapi bahagian dalam juga kita kena gosok. Okey. Sebab setengah orang kata alah gosok gigi senang je. Okey, kalau memang gosok gigi macam nampak mudah, tapi dia kena orang kata secara efektif ataupun berkesan Okey, contoh kat sini saya tunjuklah salah satu cara untuk berus gigi Okey, kita bermula daripada hadapan ni. Okey, kita berus. Okey. Okey, rapat kan kita gerus. Membulat pun okey. Kita kira dalam bilik air tu kita tengok kat cermin, kita kira. 1, 2, 3, 4, 5, 6. Okey, dekat bahagian belakang, kat geraham pun samalah. Kita membulat. Berus membulat dan di sebelah sini juga membulat. Okey. Make sure bila kita gosok permukaan gigi, kita bukan gosok dekat bahagian gigi saja. Pastikan kita massage juga sekali dekat permukaan gusi. Gusi gigi ni kadang-kadang bila kita gosok kita nampak keluar darah kan. Bila berdarah, bila gosok darah terus stop untuk gosok gigi. Okey? Tapi sebenarnya bila dah berdarah tu kita gosok lagi. Kadang-kadang darah tu adalah tak bersih sebab gigi kita bengkak. Bila kita gigi bengkak, gusi bengkak bila kita berus sikit dia akan berdarah. So jadinya adik-adik tuan-tuan tu boleh kita gosok lama-lama, ambil masa dalam 2-3 minggu, insya-Allah tak akan berdarah dah lah. Okey? Kita gosok sampai dekat kenakan bahagian gusi lah. Okey? Okey, kita buka. Okey, bahagian belakang Okey, bahagian belakang. Okey ni. Ni dekat celah sini. Orang ramai yang terlepas pandang dekat bahagian belakang ni untuk gosok Okey, yang belakang ni kita akan tolak keluar macam ni. Tolak dekat luar. Depan pun sama. Tolak keluar. Ni sama dekat sini lah. Tolak keluar. Okey, bahagian ni untuk mengunyah. Okey, kita mengunyah kan. So bahagian mengunyah tu kita kena gosok lebih. Okey, gosok 5 kali gosok. Okey, kiri kanan gosok. Atas pun sama, kiri kanan gosok. Sini pun sama, kiri kanan gosok. Dan bahagian belakang ni tolak keluar. Tolak keluar. Okay, make sure semua permukaan gigi kena-kena kena-kena lah semua permukaan gigi tu. Dan last sekali lidah. Lidah pun kita kena berus. Tariklah 2-3 kali dekat permukaan lidah. Kerana permukaan lidah ni adalah permukaan yang terdapat banyak bakteria ibarat tilam tilam yang empuk untuk bakteria kita bakteria dalam mulut duduk Okey, tolak 3 kali. Okey. Okey. Next. Okey, berus gigi. Okey. Pemilihan berus gigi ni, berus gigi banyak. Ada yang manual, ada yang auto. Tak kisah mana-mana ikut kesesuaian ataupun keselesaan masing-masing lah. Ini ada contoh berus gigi auto. Yang ni manual. Make sure berus gigi yang kita gunakan tu adalah berus gigi yang soft Bristol ni maksudnya berus dia lembut. Sebab ada setengah orang kata soft tak cukup kuat. Tak membantu rasanya untuk menggosok kan. Okey, sebenarnya untuk memberus gigi kita tak ada masalah lembut ya. Sebabnya kita punya plak ataupun sisa-sisa makanan dengan mudah keluar ya bila kita gosok dengan berkesan lah ya. Dengan teknik-teknik betul memang plak-plak ataupun sisa-sisa makanan itu yang melekat dekat permukaan gigi tu akan mudah keluar lah dengan menggunakan berus gigi yang lembut. Okey, berus gigi juga kita kena kalau boleh digantikan setiap 3 bulan sekali kita tukar berus gigi baru. Okey. Kita tak nak macam ada setengah orang pakai berus gigi sampai 8 bulan, setahun sampai apa? Berus pun dah tak nampak macam berus lah. Dah bengkok sampai ke sini ya. Okey, kita belilah berus gigi yang cantik-cantik, yang lembut ya untuk pakai tiap-tiap hari. Okey. Next, floss selepas makan. Okey. Floss selepas makan ni adalah salah satu daripada aktiviti orang kata cara penjagaan gigi. Teknik floss yang betul macam dalam gambar ni kita nampak kat sini ya, orang akan lilit dekat tangan, jari telunjuk satu bahagian dan satu lagi jari tunjuk lagi satu bahagian dan kita akan tolak tarik ke depan dan ke belakang dan naikkan ke atas. Contoh kat sini ya, permukaan belakang dengan permukaan depan. Sebab floss ni kalau makanan-makanan kan kita makan ayam, daging, sticky-sticky tu suka melekat. Perasan tak setengah orang bila gigi rosak, bahagian celah-celah permukaan ni banyak gigi rosak. Siapa yang pernah ada pergi dentist ke kadang-kadang tengok kat cermin kan, yang rosak bukan dekat tengah-tengah gigi tapi dekat celah-celah ni di antara gigi tu. Sebab apa? Sebab makanan-makanan yang lama, makanan-makanan yang kita makan yang melekat tu dia akan simpan lama macam tadilah, macam yang gambar rajah sebelum ni saya tunjuk tu. Bila makanan lama-lama melekat dekat permukaan gigi akan bercampur dengan bakteria, ambil masa yang lama, berminggu-minggu, berbulan akan menghasilkan asid. Asid tu akan menyebabkan struktur gigi ni lemah dan akan menyebabkan caries ataupun gigi berlubang lah dekat permukaan ni. So kalau boleh tiap-tiap hari tu lepas makan tu kita floss gigi lah at least satu hari setiap hari sekali ke sebelum tidur. Okay. Okay, ni antara floss yang terdapat dekat pasaran lah. Ada yang tape floss, ada yang floss biasa, ada yang ada wax, ada yang unwax, ada yang berhandle lah. Floss dekat farmasi ada, Guardian lah, dekat kedai-kedai pun sekarang ni banyak ada jual lah bagai-bagai floss ni ya. Okey, itu sajalah saya ringkaskan kat sini ya. Kesihatan pergigian tu dapat membantu pengembangan sistem menjalankan aktiviti harian dengan baik. So amalan penjagaan kesihatan pergigian tu kita patut praktikkan di usia awal. Maksudnya daripada kanak-kanak baby bila dah ada gigi, umur start 6 bulan tu kita dah start dah kena pantau gigi anak-anak untuk kita elakkan daripada berlakunya masalah-masalah gigi. Bila dah meningkat usia dalam dah 2-3 tahun tu kita dah boleh dah ajak untuk bawa anak pergi ke dentist lah untuk perkenalkan suasana di klinik gigi. Okey, itu sajalah hari ni. Terima kasih. Assalamualaikum. Kalau ada pertanyaan boleh tulis di komen, nanti Dr. Muhammad akan jelaskanlah dengan lebih detail. Terima kasih.
Thank you so much everyone for listening today. All right.
Okay, hello Dr. Muhammad. So that concludes today's session, right?
Yes. So that is the end for our talk today. If there's any questions from Andrew Farhan or any other who watched the talk today, please let us know. And there is a teaser. There's a teaser. Maybe we can do this thing that regularly from time to time. So we can touch on other subjects and other topics that is important for us.
Yeah, and here there's a comment from Datin Sivamani who says thank you for this session. Yep.
Thank you, Datin. That is our pleasure, and we hope we gave some information that is good for the public and Buku Jelitong and others as well. So who can have access to YouTube, it will be saved there, and they can listen to the talk from time to time.
Okay. Right. So thank you very much, Dr. Muhammad and Puan Noaisha, for the excellent talk on practicing and dental hygiene and practices. We at Bukit Jelutong are the most fortunate, alhamdulillah, to have skilled professionals such as yourselves to share excellent knowledge as you have, and hope that we were able to follow that your good advice too, inshallah. Hopefully we will be able to meet you again, inshallah, one day to share our experiences. Thank you.
Thank you. I think there's one question there, which was from Panaisha. What is the best way for parents can support their children so they cannot get a crooked teeth? All right. That's a very good question, actually. One thing is what we call the alignment of teeth or crooked teeth there. There are multiple factors for it. One factor is the teeth themselves, as one Aisha explained that. If we can maintain the primary teeth or the milk teeth is in their position until the natural time for it to be replaced by permanent teeth or GIGI, so the teeth itself will try to obtain an optimum position. But if the teeth extracted for whatever reason it is, caries, trauma, or any other things, then there is a higher chances or probability that the teeth will come out in the wrong position. There's one more thing, the crooked teeth or the teeth malaligned or not in a nice position is affected by multiple factors. One of it is genetics. So an example, let's say the child get the big teeth from one of the parents, then they get a small jaw from one of the other parents, then that is a problem there. But the important part that we should, with the regular visits from the to the dentist from the parents, they bring their children. So if we can tackle the problem, the earlier it is, the better. So there's a certain age time when we can tackle the problem. Then if it is a simple thing, then dentists can do something about it. If it is a complicated case, then we can refer to a specialist dentist. We call them orthodontists to tackle the problem, to do the treatment. I hope that explains your question.
Okay. So I guess that will be all for today, right?
Yes.
There seems to be no more questions. Okay. Thank you very much, Dr. Muhammad and Puan Aisha. Okay. Assalamualaikum warahmatullahi wabarakatuh.